Hi, my name is Brandy Hughes. Today I'll be providing you with my review of the Journal of Communications in Healthcare article titled Patient Engagement, Qualitative Narratives Illustrate Patient Engagement Behaviors. The authors of this article are A.G. Sloan and A. Knowles. I chose to review this article as patient and provider engagement is very important for treatment adherence. Additionally, as we know, medicine is an extremely complex industry. Therefore, patients should feel comfortable with their treatment decisions and any communication gaps should be eliminated. This article reinforces our course practice and supports the following concepts. Chapter 2, Principles of Human Communication, Nonverbal Communication specifically. Chapter 3's Nature of Therapeutic Communication. Chapter 5's Focus on Patient-Provider Relationship, Supporting Empathy and Active Listening. Chapter 6's Trust and the Importance on this in your patient-provider relationship. And Chapter 9's Self-Disclosure. This article's aim is to exemplify patient engagement and explains shared decision-making research and describes patient involvement. Patient partnership is widely studied and explores that when patients are involved in the diagnosis and treatment process, they're more knowledgeable, more satisfied, more compliant with treatment, experience better empowerment, quality of life, and even demonstrate healthcare outcomes. This article highlights factors that both contribute and hinder patient participation. The study focused their participants on oncology patients with a cancer diagnosis within the last 5 years. The method where the information was collected was via a convenient sampling and interviews specifically with 14 questions. The patients voluntarily participated with no compensation. The participants included 57 interviewees, 41 female, 16 male. The age range was from 29 to 76, and the mean age was 53 and a half. There were 46 Caucasians, 2 African American, and 9 unknown or not reported races. Various prognosis, including currently in treatment and currently in remission. Qualitative data was the favored approach to be able to capture the rich and diverse experience of cancer patients, recalling and making sense of their healthcare conversations. Next, we will review the article's highlights that contribute or hinder patient participation. The hindrances, though scattered throughout the article, are as follows. Providers not identifying characteristics of shock or uncertainty, hurrying patients, asking close-ended questions, limiting the depth of information shared, using subtle, authoritative language like you must, and patients lacking sufficient information about their illness, lack of knowledge, or low health literacy. The article highlights 8 behaviors or signs that a patient is actively participating or engaged in their care. The article starts with patient question asking. Importance of having patients' questions answered. Patients specifically describe the question and answer dialogues as a care act between them and their provider, showing compassion through patience and knowledge sharing. Patient assertiveness. Patients who explicitly state their preference, whether it be for a treatment or a medication, non-participation, family reinforcement, demonstrate engagement. Patients expressing concern. When a patient communicates a concern to their provider on items such as side effects of radiation or medications they will need to take, are engaged. Patient information gathering. Patients often carried a notebook or kept a journal to assist in their recollection of the information that was shared. So patients often that are engaged show and gather information through direct or indirect patterns. Provider information sharing. Providers who shared information openly, honestly, and appropriately were able to build trust. An example of this was when a surgeon provided drawings on a whiteboard to help explain where the cancer was and options for this individual. Provider support. Emotional support and provider sincerity during discussions of side effects and treatment options. Examples of this would be nonverbal communication, sharing hugs, shoulder touches, facial expressions. Made the patient feel more comfortable and less worrisome. Providers encouraging participation. Physicians encourage patients to reflect on options for their treatment, allowing them to have time to make the correct decision for them and their loved ones. Providers urging choice. Treatment plans are potentially flexible and enabling them to advise where they can be adjusted and where they can't to enable the patient to make adequate choices for their lifestyle. Some weaknesses of the study was that it's in a limited geographic area of the participants. The male to female ratio, I would have liked to see that closer to 50% from both sexes. And ultimately, there was no provider perspective. This was all only on the patient. So I would have liked to seen the provider perspective of the patient's care as well. Strengths of this study is that it's focused on looking to notice behavior in a patient versus simply focusing on a tool or a questionnaire that they could provide to a patient as a one-way methodology to fix this issue of engagement. There were constructive questions that were used that would allow the providers to see behaviors and be able to utilize that moving forward. And additionally, there's no extra resources or FTEs that need to be added to be able to implement these changes in your work area. My discussion questions are as follows. Do you or your organization utilize some of the behaviors listed to aid with patients in their treatment decisions? Please provide an example or a suggestion that you feel you could implement in your workplace. Provide an example where you recognized that a patient was not engaged and used one of these examples to re-engage your patient. And what behaviors do you think you could benefit from in your practice? And how do you plan to put that skill in practice? So in conclusion, patient responses indicate that providers do not consistently present sufficient patient choice. The data presents specific examples of patient engagement to allow providers and patient participation beyond question asking. This sheds light on how providers can further investigate a positive environment and promote patient partnership. Several factors can impact patient participation in the decision making. Family dynamics, cultural beliefs, communication barriers, or simply shock. This article has provided some key opportunities in determining if your patient is an active participant in their care.